When you're questioning a possible Parkinsonian syndrome in adult patients, understanding dopamine transporter status with DATScan can aid in your clinical assessment and diagnosis. DATScan Ioflupane I-123 injection is the first and only FDA-approved adjunct imaging agent that uses single photon emission computed tomography imaging, or SPECT, imaging to visually assess dopamine transporter, or DAT, density in the striatum, which may aid in the clinical diagnosis of a Parkinsonian syndrome, or PS. DATScan is a radiopharmaceutical indicated for striatal dopamine transporter visualization using single photon emission computed tomography, or SPECT, brain imaging to assist in the evaluation of adult patients with a suspected PS. DATScan may be used to help differentiate ET from tremor due to PS, including idiopathic Parkinson's disease, multiple system atrophy, and progressive supranuclear palsy. These three conditions have all been associated with dopamine transporter degeneration in the brain. DATScan is an adjunct to other diagnostic evaluations and was not designed to distinguish between these three conditions. Additionally, the effectiveness of DATScan as a screening or confirmatory test and for monitoring disease progression or response to therapy has not been established. It's important to note that DATScan is contraindicated in patients with known hypersensitivity to the active substance, any of the excipients, or iodine. In clinical trials, headache, nausea, vertigo, dry mouth, or dizziness of mild to moderate severity were reported. In post-marketing experience, hypersensitivity reactions and injection site pain have been reported. A suspected PS is not always straightforward. Patients may present with a variety of symptoms, some of which can be typical or atypical, overlap, or mimic other conditions or movement disorders. Additionally, the more typical signs of a PS, such as tremor and response to medications like levodopa, may be misleading in some patients, contributing to an inaccurate or delayed diagnosis. Delayed or inaccurate diagnosis may result in lack of effective treatment with the potential consequences of unnecessary disability and negative impact on quality of life, or inappropriate treatment that may expose patients to the risk of side effect without the therapeutic benefits. Additionally, without a proper diagnosis, patients may undergo further diagnostic testing, which can carry unnecessary cost and stress. When you suspect a PS, SPECT imaging with DATScan can add the clarity of dopamine transporter status visualization to symptom presentation. To understand how DATScan works, it's important to understand the role of the dopamine transporter, also known as DAT. Dopamine is a key neurotransmitter involved in the modulation of movement and is located in specific areas of the brain, including the striatum, which is affected in Parkinsonian syndromes. Dopamine-containing neurons project from the substantia nigra to the basal ganglia. Parkinsonian syndromes, such as PD, have been associated with a marked loss of dopamine neurons in the substantia nigra. During normal dopaminergic neurotransmission, dopamine molecules are released into the synaptic cleft and activate postsynaptic neurons. Dopamine is then removed from the synaptic cleft via DAT reuptake. DATs are membrane proteins located on the surface of functional presynaptic neurons. In a normal SPECT study, the Ioflupane radiopharmaceutical molecules in DATScan bind to the DATs, which are present on presynaptic neurons in the striatum. Because there are a normal number of intact neurons with a normal number of intact DATs, this binding results in a normal SPECT pattern, comma or crescent shapes in the region of the striatum bilaterally. In non-PS patients with essential tremor or other non-neurodegenerative conditions in whom dopaminergic neurons are intact, the same normal SPECT pattern appears. In patients with Parkinsonian syndromes, there is neuronal degeneration and loss of dopaminergic neurons in the striatum, So there are fewer available for Ioflupane I-123 to bind to. Therefore, when these patients undergo SPECT imaging, the Ioflupane molecules bind to far fewer DAT proteins in the striatum. This results in decreased Ioflupane I-123 binding, which produces an abnormal SPECT pattern, one or more period or oval shapes, as well as reduced image intensity on one or both sides of the brain. Clinical evidence supports the efficacy and safety of DATScan. In NDA clinical trials, DATScan demonstrated agreement among readers. DATScan images were evaluated by readers blinded to clinical information at the time of the read. This table shows the positive and negative percent agreements of the DATScan image results with the reference clinical diagnostic standard. Positive percent agreement represents the percent of patients with abnormal DATScan images among all the patients with the clinical diagnostic reference standards of PS. Negative percent agreement represents the percent of patients with normal DATScan images among the patients with a non-PS clinical diagnostic reference standard. The effectiveness of DATScan as a screening tool or confirmatory test and for monitoring disease progression or response to therapy has not been established. Additionally, in NDA clinical studies of 942 patients, no serious adverse reactions were attributed to DATScan. Other adverse reactions occurred at a rate of 1% or less and were reported as consisting of headache, nausea, vertigo, dry mouth, or dizziness. These reactions were of mild to moderate severity. In post-marketing experience, hypersensitivity reactions and injection site pain have been reported. Unfortunately, there is no definitive diagnosis confirmation currently available for a suspected PS. Assessing your patient's dopaminergic status by visualizing dopamine transporters with SPECT imaging with DATScan may aid in your clinical evaluation of patients with a suspected PS. This additional information that DATScan provides enables an enhanced understanding of a patient's condition and more informed decision-making for clinicians, patients, and caregivers. When questioning a possible PS in adult patients, visualize dopamine transporter status with DATScan to aid in patient assessment and diagnosis. Please see the product indications and important risk and safety information that follows.